When you think about surgery, you worry about the big stuff, right? The procedure itself. But what if one of the most frustrating challenges is actually a strange, unseen injury that pops up after you're already home? That's what we're digging into today, a real medical mystery that starts in a place you would never, ever expect. So, where does this whole story begin? It starts with what you could call a phantom sensation. It's this incredibly frustrating, really confusing pain that just seems to appear out of thin air, right there on your skin. Have you ever felt something like this? A weird burning or tingling, maybe even some numbness on your outer thigh that you just can't explain? I mean, you look down, there's no rash, not a scratch in sight. You start thinking, is this an allergy? Did something bite me? But you just can't find a reason for it. It's super specific and honestly pretty baffling. And this is where it gets really interesting because everything, all the signals your body is sending you, they're screaming, skin problem. But the real cause? It isn't on the surface at all. Nope. The source is actually hidden, way deeper inside. Okay, so what is this thing? This phantom pain has a name, and it's a bit of a mouthful: meralgia paresthesica. So let's just break down what that actually means. Right, so meralgia paresthetica, let's just call it MP for short, is what doctors call an entrapment neuropathy. It sounds complicated, but it's really just a fancy way of saying a nerve is being pinched or squeezed. And the craziest part, this whole thing boils down to one single nerve, the lateral femoral cutaneous nerve, or LFCN for obvious reasons. Its only job is to give you feeling on that patch of skin on your outer thigh. That's it. So think of it like a garden hose, When that nerve, our hose, gets pinched or stepped on, the water, or in this case, the nerve signal, can't get through properly. And that's what causes those weird sensations, the numbness, the tingling, that burning pain. So, the big question is, what's doing the pinching? What's stepping on the hose? Well, the causes are actually pretty varied. Some are things you might even guess, but others are a totally unexpected side effect of the very thing that's supposed to be helping us get better: medical treatment itself. Okay, so you've got two main buckets for causes here. On one side, you have what you could call spontaneous causes. We're talking about things like wearing really tight jeans or a heavy belt, obesity, or even pregnancy, basically anything that puts extra pressure on that area. But then on the other side, you have what are known as iatrogenic causes. And that's what we're really going to zero in on today, when this condition is accidentally triggered by a medical procedure. That word, iatrogenic, it sounds a little scary, but all it really means is that a condition was caused by medical treatment. And look, this isn't about pointing fingers or placing blame. It's just about being aware of the unintended side effects, the risks that can come along with even the most routine and necessary procedures. All right, now we're getting to the real heart of it, because not all surgeries are created equal when it comes to this risk. The research actually points to a few very specific procedures where your chances of developing meralgia paresthetica are way, way higher. Let's kick things off with a pretty common one: bariatric surgery. The data we have shows that about 5% of patients might end up with MP. Now, I know what you're thinking. 5% doesn't sound huge, right? But think about how many of these surgeries happen. That 5% adds up to a lot of people who are dealing with this unexpected side effect. Okay, from there, the risk pretty much doubles when you start looking at certain orthopedic surgeries. Specifically, we're talking about hip replacements that use what's called the direct anterior approach. Here, the rate jumps up to around 9%. And honestly, it kind of makes sense when you think about it. The path the surgeon takes goes right past that nerve we were talking about, making it super vulnerable. But wait, neither of those even come close to the biggest one. The number one iatrogenic cause of MC, it's spine surgery, especially when the patient is positioned face down or prone. Why? Well, during these long surgeries, they use these firm supports to hold the pelvis in place, sometimes for hours on end, and that pressure is applied right where that nerve runs. The result? The overall incidence is a shocking 16%. And get this, for some specific procedures, like spinal fusion for scoliosis in teenagers, the risk can climb as high as 25%. Just let that sink in. 1 out of every 4 patients. And looking at this chart really drives the point home, doesn't it? You can literally see the risk just climb and climb, from 5% with bariatric surgery up to 9% for those hip surgeries, and then bam, that huge 16% jump for spine surgery. It just goes to show how much the type of procedure really, really matters. Okay, so I know we've just talked about some pretty alarming risks, but I promise, here comes the most important and, frankly, the most reassuring part of this whole story. What happens after you get iatrogenic MP? Well, let's take a look at the road to recovery.
And here's the really good news. For the vast, vast majority of people, this thing just gets better on its own. After about 3 months, a lot of patients start to notice the symptoms are fading away. Fast forward to 6 months, and there's usually a huge improvement. And by the 1 year mark, most cases are completely gone, all without needing another surgery or any kind of invasive treatment.
So, if there's one thing to take away from all the research, it's this. Just being patient and using conservative treatments is super effective. Your body is pretty amazing at healing itself. That poor nerve just needs some time to bounce back. Needing another surgery to go in and fix it, that is extremely rare. And that really brings us to the final question, doesn't it? We know meralgia paresthetica is a real risk for certain surgeries. We know it can be scary and frustrating, but we also know it almost always gets better by itself. So knowing all that, isn't this a conversation worth having with your doctor before you go into surgery? I mean, just knowing what to expect can make all the difference in the world.